Hello everyone, welcome back to Board Aspirants. I'm Dr. Swati Gupta. In this video, I'll be talking about productivity. Productivity, especially for everyone who's just finished dental school or who's maybe in 1 to 2 years in practice or even more and still struggling with productivity. So, what are the main things that hinders our productivity? Right, and I was struggling with the same issues. I was talking to so many dentists. I was asking everyone, observing the people who were making more money, and they were not killing themselves. It was not a matter of they were running around, running three dental chairs at a time. They were all very organized. Yes, the key to productivity is organization. And in this video, I'm going to tell you 5 important things that I've learned from everyone, the dentist, the most productive dentist I've talked to, and what they have been telling about productivity, and I use that in my own practice, and I've noticed a huge change. I don't have to kill myself to make money, to be sure that I can see more patients and at the same time be happy. That's what we want. We want to be working and we want to be happy. We don't want to kill ourselves. So this video is all about making your self organized. Okay. So what is the first thing that you want to know to be productive? And that is, like I said, organization. Now, organization, how? We all are trying to be organized, right? But what happens? So, if a dentist has to make more money, that means you need to save time. And save time also means you need to see more patients. You need to see more patients. And that would also mean you're running around for managing 2 chairs at a time or 3 chairs at a time, as in like 3 patients at a time. But how do we do that if I don't even know that I might have those patients? So how it's done in a private practice or any practice for that matter is usually you have to see your schedules a day before, and that's, I'm telling you, most of the dentists you'll talk to will know what kind of schedule they have the next day. Okay, so and I started incorporating that into my life also, and that's a huge change. So every day before I leave, I'll check my schedules and I'll be like, okay, I have 10 patients tomorrow, and these are the 2 or 3 chairs I'm running. And what all patients are there? Is it a recall? Is it a new patient? Is it a composite on one chair and a crown on the second chair? And I know everything exactly, so I prepare myself accordingly. I'll see, okay, what composite is there, what tooth number I'm going to do, what all things I might have to be sure of. I look at the x-ray, have a mental picture. Okay, this is what I'm looking at. Okay, crown, this is what I'm looking at. This is what I might get into. Okay, it's a number 3 crown. That means, an adjacent tooth. What is the tooth condition? It kind of helps you understand and be prepared of what you're going to have. Now, we always, at least in my clinic, keep chairs separate for emergencies. So that is something you can't control. Emergency is like, okay, it could be a tooth pain and you have to maybe write an antibiotic for that patient, or it could be a root canal that you can probably give an appointment for a later date. But those are something unexpected you can't be prepared for, but you can be prepared for your own patients that have been scheduled for that day. And that means what I'm doing that day, how many chairs I'm running 2 chairs. Okay, what our patients are coming, and I have a very clear idea, a very clear picture of for that day. Now, I had a dentist who had a dentist friend who was always going to the job, like maybe all half an hour to maybe 20 minutes before. He's always there in the clinic, and you would, even assistants won't be there, no one would be there, but this dentist is always there. And he was not even the owner dentist, but he was one of the very highly producing dentists in the office. And what he was doing always was, he'll come, he'll sit there, and he'll make a he'll write down in his notebook, a tiny notebook that he always carried, that okay, these are the patients I'm seeing today, this is what I'm doing. Okay, these are the x-rays, what kind of problems I can get into, what I should tell the patient in advance, what I should be prepared myself for. Okay, so he you have to have a mental picture for that day for all the patients that you're going to see. It could be a day before you prepare yourself. That's what I do before I leave the clinic. I see all the patients, I see all the x-rays, I know what I'm going to do, so I'm prepared for that day. If there's anything that I don't know, I'll ask someone, before, and be prepared. So organization, and that means know what you're getting into. Now, here, the second thing that's really important that can help you be organized is your dental assistant. Now, I'm not really sure that every clinic will have, a dental assistant that is just for that particular doctor. But if you have that kind of a scenario in your clinic where you can have a dental assistant helping you out, and you only have one trained dental assistant for yourself, like ABC, and you've trained the dental assistant, the dental assistant assists you for all the cases, that's perfect, because you've trained that. Like my assistant, I've trained her completely for everything. Like she knows that, okay, whenever if she's doing a crown, she knows what exact my steps are, what exactly would I want to know prior to starting the crown. Do I need x-rays? What kind of x-rays I would need? How to, make sure that everything goes comfortable and smoothly, what kind of burrs I would need. So everything is really good. Okay. So I really think that having a trained dental assistant, or if you cannot have one dental assistant and you may be having two, three dental assistants who, temp, or everyone is coming, have a talk with them prior early morning. If they come early, just have a talk with them. Okay, this is my schedule, I'm doing recalls, I'm doing new patient, this is what I need before. So that makes it really fast, because everything is there. You have two patients and you are running the chair. You cannot waste time and telling the assistant, okay, get me this, oh, this is not here, oh, that is not there. It's a wastage of time, right? So we all want to be productive, and assistant can really help you in being productive. They can make things go really smooth, and I've been observing that a lot in my practice. How things have changed from the time that I've started training the dental assistant. Okay, what do you have to even talk to the patient? I even told the dental assistant, okay, you can talk to the patient when I've done the treatment plan. If they have any doubts, tell them these things, the things that I normally tell the patient. If they don't understand, I'll come and explain. But otherwise, they save my chair time so much, because I'll be on the second chair doing some other procedure. Now it's their duty to tell the patient, explain everything, get all the signatures, whatever has to be done, any doubt that has to be cleared. If there's something that they can't clear, I'll come back. But it saves your time. Any post-op instructions that have to be given after procedure, they'll be doing that part. So, it's like a team effort. And I never used to believe, because when we were in dental school, we really don't have assistants, so we never understand the importance. And there we were doing one patient in 3 hours, but here we are not. We are actually spending like 15 to 20 minutes, or maybe half an hour or something on one patient. So a dental assistant can really, really help you. And that brings me to my third important point, and that is having your kits prepared. So this is something I learned again from one of my dentist friend, that my friend, he has all the kits prepared. Like he has a composite kit, a crown kit, a RCT kit, a periosurgery kit. Everything is prepared, as in, like, every dentist has, all of us have our own likes of burrs, right? I like this particular burr to work on a crown, I don't like this particular instrument, I want this instrument. So instrument kits are there, burr kits are there, and it's really, really helpful. I remember when I started working, I was always like, oh, there is no chisel here, I need a chisel. Oh, this is a flame shaped burr, this is not what I want another burr. Because we are so used to working with those specific instrument and burrs, even if something else would work, we are not used to it, right? So then it's you are kind of experimenting at that time on the patient, and I was doing that, and it was really frustrating, and I was like, where is my instrument? But that was my fault, because I had not prepared my kits before. I was less like, okay, these kits are used by everyone, and so the assistants were just giving me the kits that are used by other doctors, and they were like, they are comfortable with it, but I wasn't, right? I wanted my own specific instrument. So now even I have my own composite kit, I have my own burr box, and some instruments might not be there in the clinic, so I purchase my own set of some instruments that I need. And I have my own instrument, I'm like, okay, these are my instruments, I want to use them. And that works. That really made me productive again, because I've been using them from so long that this is what you know is good in my hands, and I work well with them, and that really reduces my time. So yes, your kits, You can ask your rental assistant to help you out, prepare your kids, or whatever way works with you. And then, like, so after having your kids, after having everything, I think one major thing that's actually worked for me, now I counted it as one of the five things, but that might not be for everyone, but for me it is. That is the magnification loops. Like, when I did not have the loops, I never knew what loops can do. But now when I have the loops, I know what they can do. And that means is how magnification can change everything, right? When everything is so nicely magnified, be it 3.5, be it 4. I use 3.5 magnification loops, but they really help you. Everything is so crystal clear. You know, your crown margins will be so good once you know that, you have the loop, and you can see the crown margin so well. Now some people say, okay, I'm not using the loops, I'm okay with it without it, but I really prefer using the loops, and loops make things easier. Your diagnosis is very much, everything is there. Sometimes I've noticed that when I'm not wearing my loops, I don't tend to see things like very clearly. But with loops you can really see, okay, the whitishness or the discoloredness or the margin. Especially I've seen, even while doing RCTs or any surgical procedure, things become really easier. So loops I definitely count in my five most important things. And last of all is ergonomics. Now, I've made many videos on ergonomics, and you can go back to my videos on ergonomics. Ergonomics is really, really important. Why am I saying it's important? You can have the loops, you can have the composite kits, you can be organized and know I'm working these chairs. Your mind, mentally, you can be prepared. But if you are not ergonomically practicing, you are not healthy. Your shoulders are hurting, your wrists are hurting. Like, you will find a link to my old video. I had a phase when I had tendonitis, and no matter how organized I am, if I'm having pain in my wrist, if I'm having any issue, I have people who are really good in their work, but because of their hand situations, because of their shoulder pains, they're so scared to even work that much. Then there's no point. You can never be productive because you're scared of your health, and your health also does not permit you to do anything. So ergonomics and taking control of your own health, making sure you're healthy, that would mean when we are working, ergonomically working. And again, it's all tied up together. Your health is tied up together with your magnification, how magnification loops can help you with it, how being organized can help your mental health. If you're mentally healthy, you have more time to devote to your physical health. You can go back, when you come back home, you can be less stressed out because you're not worried about what's going to happen tomorrow. You're right. So if you're not mentally stressed out, you're physically okay. And physically okay also comes from how you're working at work, how ergonomically you're maintaining yourself. So everything is all together. And I'm telling you, if you're worried about I'm not productive because I do not have the speed right now, that is not the truth. There are so many dentists who still, like, 5 years out of dental school, and would be like, I do not still have the speed to do a 10-minute or maybe 30 minutes crowns, or I do not have the skill to do RCT in few minutes or something. But they still are very productive. And in the what do you mean by productive is that they still manage to do a lot of patients. And the reason they manage to do a lot of patients is that they're organized. They know what I'm doing, so they distribute the time of their patients accordingly. If they know that I do not do RCTs in 30 minutes, they give themselves 30 minutes completely for that particular time slot, and will not have a side book because they know I cannot really be running around. Um, so there are so many things that can come from a productivity, and productivity comes from being organized. And when you're organized, then you can focus on your speed. Then you can actually look at the speed and productivity. Your productivity, being organized, and speed combined together, you can make more money and be more happy. But try to be organized first, and then put other things into this equation to make everything work for you. I hope you like this video. If you like, share and subscribe. And if any questions, like I always say, just send a message and I'll be happy to help you. Okay, bye bye.